the rudder! Raise the sails! Raise the sails!
Captain, an unidentified ship is approaching. Over.
Roger. Wait, is that an enterprise sales solution?
Reach sales professionals, not professional sailors. With LinkedIn ads, you can target the right people by industry, job title, and more. Start converting your B2B audience today. Spend $250 on your first campaign and get a free $250 credit for the next one. Get started today at linkedin.com/campaign. Terms and conditions apply.
The Hilton sale is on. Now through September 29th, you can save up to 20% on stays this fall and beyond. Long weekends, last-minute getaways, holiday gatherings. There's a Hilton stay for all of them. More moments, more experiences, more destinations. Now 20% off for a limited time because it matters where you stay. Don't wait. Book by September 29th and save up to 20% at Hilton.com. Terms apply. Hilton for the stay.
A patient sans patience. I'm sick and tired of being sick and tired. Sick and tired of medical forms and filings and faxes. Sick and tired of bureaucracies and bureaucrats. Sick and tired of treating symptoms, never causes or cures. Sick and tired of pollyanna pundits and politicians. Sick and tired of systems and structures built by and for only the fortunate few. Sick and tired of the sick and tired system that got us here. Sick and tired of the sick and tired system that's keeping us here. Sick and tired of the sick and tired system that hasn't a clue or care to get us out. Welcome to Nevertheless Persisting, a show inspired by a moment in time about the moments we persist through over time. I'm Dr. Amy Blackstone. In 2020, I boarded a plane. I caught a virus. It changed everything. Having sociology to make sense of it all kept me sane. I'm a public sociologist, and I'm sharing a lens that could change everything for us all. In this podcast, I'm joined by my husband, Lance. We're a couple of sick and tired child-free Gen Xers who lament the idiocracy that surrounds us, propose solutions we expect will go ignored, and take a moment to check in and take stock. How you doing, Lance? Sick and tired?
Yes.
Congratulations. Me too.
All of the above.
I actually wrote this a few years ago, but it still applies. I, too, am still sick and still tired.
Yeah, did you write this before I got sick?
How long have you been sick?
Since summer 23.
I don't know.
Okay.
I think I did, actually.
Huh. I think you didn't post it until recently, though.
Yeah. Yeah.
Okay.
That's true. Who knows? I've been sick and tired for a long time.
It's true. Yeah, today I am starting to run on fumes. It's about 5 o'clock here, and I was up early and working. And shockingly, I've been enjoying my work recently, which has motivated me to work more. And I've noticed that at the end of the day, I am spent.
Tired, perhaps.
Yep.
Okay.
Yep.
Well, I'm feeling very ranty today. I've had a maddening few days. So this particular post feels like a good one to talk about. And I have a couple of themes that I'd like to discuss with you today.
Oh, tell me more.
Okay. One, for me, this piece highlights how maddening and disempowering it is to be a patient in our healthcare system, in the great medical industrial complex that is what exists here in the United States of America. And then the other theme that eventually I want to discuss with you is that I believe we're seeing a rising class consciousness in the United States of America, and that our healthcare system is one place where wealth inequality is abundantly clear. And those are some of the themes that, to me, I tried to get at in this piece. So I want to talk about that too. But back to theme one first.
Back to theme one.
Which is I'm mad as hell and I can't take it anymore. And I
Yep.
feel disempowered by our healthcare system.
Yeah, we've talked about this before, but for me, the amount of inefficiencies at all levels is just staggering.
Mm-hmm.
I think I told you earlier today that we're about to go on for those of you listening, we're about to head out on a road trip to go see a friend's daughter get married. And in order to be prepared for that, I wanted to get a couple of months worth of my prescriptions. And to do so, there's an app. And when you go into the app, you click a little button, and it just basically seems like it's so simple. It'll send the prescription request to your doctor. The doctor will fill it. There's a notes field so you can ask for or say things. And so I put in there that I was requesting 2 months, which is, one of our prescriptions is something that has to be compounded, which means the pharmacy actually has to custom blend it. It's not just a pill that comes. So it's a little bit of a pain in the butt because you have to find a compounding pharmacy for this. And so I wanted to get all this done before we left. And of course, the app tells me it's been sent to the pharmacy. I don't hear anything from the pharmacy after 4 or 5 days, which I usually do, hear something. I call the pharmacy. They act like they've never heard anything before. I tell them that I'm leaving town. They tell me it's going to be ready after I leave town, as if I didn't tell them I'm going to be gone. I go back to the app for my doctor. I try to find a phone number to call. I call the phone number. It gives me 45 options. I pick the option that I think is right for neurology. And suddenly I'm in the sleep studies queue.
Oh, you made
which
the
I
wrong
don't even
choice.
know if I'm I can't get a hold of anybody.
That's your fault. Ding dong.
So it's maddening.
Here's this app for you to use. You can use it, but we won't use it.
Well, that's the other piece, right? Which I didn't even talk about. We have, with our primary care doctor, we have one app. With our neurology doctor, we have another app. And in both cases, there's, features in the app that you think are available, and you say something, you put a note in, you make a request, and it just goes nowhere.
Yeah.
And they're like, and then you talk to them and they're like, yeah, we don't use that. Like, what is the point?
Yeah. Yeah.
So anywho.
And I know we're not alone. I have heard so many frustrating stories just like this. I wrote this years before Luigi Mangione was a name that everybody knew, but we all know that name now. In case this is a new name to you, he was the 26th.
For all of you who know it.
Yeah, well, I mean, I think most everyone does. But if you don't, he's the 26-year-old UPenn graduate who shot United Healthcare CEO Brian Thompson in the back in December 2024. He himself had a history of chronic back pain and ongoing struggles with the healthcare system. And it is presumed that the reason he shot UHC CEO Brian Thompson in the back has something to do with his own personal experience in the healthcare system. And I'm not suggesting that this is an action everyone who's frustrated with the healthcare system should take, but it is, I think, evidence of just how maddening and disempowering it can be to be a patient in this system. And, like I said, so many stories emerged after that incident that indicate that we're not alone in this experience of just utter despair, frustration. And this was, I immediately thought of this piece, and I can relate to Mangione's despair. I too have had my own feelings of just despair and feeling like I'm out of options.
Yeah.
Yeah.
Yeah. Not necessarily to go out and kill somebody, right?
No.
It's to, end your own despair.
Mm-hmm.
And so, yeah, there's kind of a couple of really horrible outlets that people get pushed to.
Yeah, absolutely.
So, yeah, and I think this starts to. I have a couple of comments, but I think this starts to probably get us into your second theme.
Okay.
But in this country, a lot of it, I mean, it's very complicated, but a lot of it is couched in, it's couched in efficiencies. It's couched in saving money. It's couched in terms of what does it cost to do these things, and preventing people from gaming the system and cheating or stealing from the system or whatever. And, the fact is, right, that it really has nothing to do in our country with a lack of money.
Mm-hmm. Mm-hmm.
And it has everything about who gets to keep the money or keep most of the money.
Right.
And again, sorry, this will probably start to talk about your next point, but we know the U.S. pays more for healthcare than any other country in the world.
Yep.
And we also know that we have worse outcomes than any other comparable country when it comes to, if we're comparing countries that are kind of in the same financial wealth bracket,
Mm-hmm.
right?
Mm-hmm.
So anyway, I just looked up some facts, right? Like we pay in the U.S. essentially twice as much per person on healthcare
Yep.
as these other comparable countries, which I think you're going to talk about later. But we also have, like I said, worse outcomes. So we have lower life expectancy, we have higher infant and maternal mortality, we have higher rates of chronic disease, and we have more avoidable deaths.
Right. This is what our higher costs get us.
Right. Right. What it gets us is CEOs that are compensated at ridiculous levels and rich shareholders who pocket that money.
Right.
And it's really a redistribution of wealth, right? Because most of this is, or I should say, I don't know if it's most of it, I won't say that as a fact, but there's a large percentage of this is tax money funding a lot of this stuff ending up in the pockets of the wealthy. And, full disclosure, right? We're okay. We have investments. We have money in the stock market.
Yeah.
I'm sure we have money in some of these companies because we invest in mutual funds and
Right.
all that kind of stuff, which is a whole different subject. But I personally would rather have lower returns and better health outcomes on my portfolio.
Yeah. Well, speaking of wealth, let me transition to our second theme.
Well, I want to say one other thing before we do that.
Sure.
So, kind of coming back to Luigi
Mangione.
Luigi Mangione and the shooting, like I can totally understand the frustration. So, and bear with me here as I pull out some Weber for you.
Max, you've got Max to quote?
So I think
and you even pronounced his last name right?
Well, yeah, my mother is German, so.
For those of you not in the know, it's spelled like Weber, but it's pronounced Weber.
Right.
Okay.
So I'm pretty sure he's the guy who said something along the lines of the modern state claims a monopoly on the legitimate use of physical force, that being violence, within its territory. And I think about this in terms of who has the power to make life and death decisions about people.
Yeah.
And, again, assuming you're following the ball here, one could argue that when it comes to rationing something that determines life and death, something like healthcare, that the state or government should be the one exercising the power. Now, obviously, this is also couched in a context of hopefully we have a representative democracy that's functioning well and all that kind of stuff. But there's all sorts of places where this can fall apart. But I think most people could agree that in general, it's probably not corporations that we want deciding who lives and dies.
Right.
And if you don't think that, something's wrong with you.
Right.
So back to the point that in the U.S., we've essentially abdicated this power to insurance companies.
Right.
And so Brian Thompson was literally deciding who got to live and die, and not to mention all the people suffering due to policies that denied and delayed treatment. So, Luigi didn't die, but again, we'll extrapolate that maybe he had personal issues that
we know
led
he
him to
did.
this.
Yeah, there's been plenty of evidence.
I don't know that
released
he's
since
said.
then
I don't know
shows
that he's said explicitly.
He did.
That, okay.
Yep.
All right. Cool.
Yep.
So anyway, somebody who's suffering all the people that are suffering as a result of these decisions, essentially we're letting the insurance companies decide who lives and dies, and also essentially who is punished.
Yeah.
Right. Like if you don't get treatment because you're denied,
right,
you're essentially being punished, and it's out of your control.
Yep.
So that's what I had to say about your theme one.
Well, I'm glad we took a moment to hear that. For the folks listening out there, my husband just quoted sociologist Max Weber to me, sociologist Amy Blackstone. There might be sexy time later. I have goosebumps. This has never happened before. I mean, I've had goosebumps before and sexy time before, but I've never been quoted a sociologist by my husband just out of the blue. Okay. Anyway, that was lovely. Thank you. Moving on to theme 2. As indicated by Brian Thompson's shooting and the public's reaction to it, I would argue that we're seeing a rising class consciousness in the United States, and that our healthcare system is one place where wealth inequality is abundantly clear.
Yeah, so this kind of builds on what I was just saying, is that the class that's making these decisions are essentially executives and ultra wealthy shareholders, of which Brian Thompson was both.
Yeah, absolutely. And I don't think there would have been as much support for Mangione before the pandemic, because I think that the pandemic raised our consciousness about the tragic state of our healthcare system. And I also think that it's not just healthcare. I think that just awareness, consciousness about income inequality is greater than it was, and income inequality is greater than it was. The Urban Institute has a bunch of really interesting charts on wealth inequality, and I'll share a link to their site in the show notes. But just as one example, in 1963, the wealthiest families in the U.S. had 36 times the wealth of families in the middle of the wealth distribution. 36 times the wealth of families in the middle of the wealth distribution. In 2022, they had 71 times the wealth of families in the middle. So, I mean, it's gone nuts.
Yeah. Yeah, I think, regarding support for Mangione and kind of people's reaction to that, I think all the reasons you mention are accurate. I also think that we heard a lot of things specifically about UHC leading up to the shooting. So they were in the news a lot.
Okay.
And I think it's a lot easier publicly to kind of get behind something when there's a straight line from like UHC has an explicit delay, deny, defend policy that becomes public. And that's widely in the news. And, that's as opposed to something that's a little more abstract, like healthcare is failing generally during the pandemic and people are upset. But I think this is kind of it's almost a perfect storm, right? Because you have kind of all these general things happening, and then you have kind of this pointed example, right? Like it kind of collapses down to this, like this company, this CEO it's out in the world that they're doing this.
Right. Yeah.
And so it's just kind of layered on top.
Right.
Yeah.
In terms of mass support for Mangione, I would also argue that it doesn't hurt that he's rich, that he's white, that he's a cishet dude, and that he's damn sexy.
I can see how that would help you out with this.
I mean, I don't care about the cishet stuff.
Mm-hmm.
I don't care about the rich white stuff, but he is damn sexy, and nobody can argue with that.
All right.
That is empirically true.
All right. I got nothing to add to that.
Let me just I would like to share a quote that's related to this theme, kind of wrapping up this theme, from a sociologist. I'll share a sociological quote with you that's more recent, from an opinion piece.
I'm so proud of you.
You get quotes from sociologists every day of your life.
I love my sick sociological life.
Okay, Heather's quote that does not age well, but I like how you adapted it. Anywho, a quote from sociologist Megan Thiel. Forgive me if I mispronounced your name.
Tila, but
Tila.
go ahead.
Okay. From the independent news outlet Common Dreams, and I'll share a link to this in the show notes as well. But she wrote a really great op-ed shortly after Brian Thompson's shooting regarding Mangione and what we might make of all of this. Here's what she has to say. To honor Brian Thompson and to ensure his death is not in vain, we can engage in the needed conversation about the extreme depravity of our healthcare system, which his death revitalized. A path forward that reforms a calloused healthcare system can provide benefits to us all. Those among us who deeply mourn Brian's death can take solace that it can impart a legacy of positive, sustainable, and overdue social change. Those among us who view Mangione's action as predictable, if not understandable, can appreciate the same reform.
This episode is brought to you by Nespresso and Samra Origins by the Weekend Coffee Collection.
Introducing Samra Origins. My collaboration with Nespresso is a connection to my roots, to my mother, Samra. Coffee that hits the right notes. It transports you. Crafted with unique notes and bold, soaring flavors. Experience a taste that moves you. Nespresso and Samra Origins.
Discover more at Nespresso.com.
When your investors, customers, and workers demand more from your business, make it happen with SAP. The AI-powered capabilities of SAP can help you streamline costs, connect with new suppliers, and manage payroll, even when your business is being pulled in different directions. To deliver a quality product at a fair price while paying your people what they're worth too, so your business can stay unfazed. Learn more at sap.com/uncertainty.
Yeah, I read that and I get it.
Mm-hmm.
I'm not sure I'm behind honoring Brian Thompson on any level. But, I would say that in a well-functioning democracy, either he would not have been incentivized to cause the damage he did.
Yeah.
He would not be allowed by law to do so, or he would be removed and punished if all of the above failed. So I can understand the sentiment that's written there, but I also am moving into a world where I feel like we're sugarcoating all sorts of stuff to, I feel like people, on the left who have been trying so hard to be fair and balanced about things, to quote Fox News, are like tripping over, our own dicks to do that. And the reality is that what we should be able to agree about is that a person in his position should not be allowed to do what he's doing. And the behaviors that those companies are engaged in, while maybe not illegal, should be illegal.
Right.
And we should be thinking about the point of healthcare and what it's for. We should be looking at how rich we are as a country and making sure that, people are taken care of. And we should spend less time worrying about the very few people who game the system and the massive amounts of money that we lose through people being sick and dying. I mean, again, and that's me bringing it back to an economic argument, right?
Yeah.
Like, you don't have to bring in the morality or the empathy or sympathy or ethics or any of that kind of stuff. It just costs us all more for us to not do this right.
Right.
But the reason that we're not doing it right is because the few are consolidating the money and the power.
Right. Yeah.
And that's the only reason.
Right.
So, yeah. And the only thing that I'll say in addition is 100% agree that Mangione's actions were predictable.
Right.
And by that, I don't mean him specifically,
Yeah.
but somebody was going to do something.
Right. Yep.
And I think you're just seeing, I don't know, again, analogy guy here, but, you can only, scrape away so much thickness from the dam wall before it breaks. But right up until the point it breaks, everything looks fine and it still works and everything's great.
Right.
But at some point, something causes that last little bit that breaks whatever it is.
Right.
And you see things, but you don't necessarily know where it's going to break. You don't know how it's going to break, but you know that if you keep going down this path,
right,
something's going to break.
Right.
So somebody was going to do something.
Right. Yeah. I agree with everything that you said, with one exception, and that I'm going to have to paraphrase because I don't remember exactly what you said, but you said something to the effect of, those of us on the left keep tripping over our own dicks, blah, blah, blah. I agree that those of you on the left that have dicks keep tripping over your own dicks and fucking up. So I would suggest, and speaking of reform, I do have some solutions. So I think we could move on to solutions. And the first one is that those of you with your own dicks, maybe shut the fuck up and listen to those of us without dicks. Forgive the gender and sex essentialism here, but some of us without dicks do have solutions, and we are on the left, and you could listen to us. And one solution I have... What? You just like laid that out there for me, so I had to pick it up. One solution I have is actually related to a solution that you suggested, and you are a dick holder. Haver, occasional holder. This is going down a path that I did not expect.
You just keep digging.
Per the
Would you like another shovel?
Per the Commonwealth Fund, the United States spends the highest percentage of its GDP on healthcare. I think you made this point earlier, or a similar point.
I did, but I think carry on.
Okay, so we spend the highest percentage of our GDP on healthcare compared to...
Which is what?
Our peers. Well, I only have the 2022 number, so that was 16% of our GDP in 2022, compared to 9 of our international peers. But we rank lowest on healthcare performance compared to those same peers.
Just list off some of those peers.
Yeah. Okay, so the Netherlands, the UK, Germany, Sweden, New Zealand, France, Canada, Sweden, and Australia. And I think that probably we have way too much pride, going back to the people with the dicks, to take any lessons from these nations. But probably we should.
Right. Well, I mean, it all comes down to in our politics, the demonization of anything called socialized whatever, right?
Mm-hmm.
And of course, this is very selective, right? Like there's a huge amount of hypocrisy, dishonesty, whatever you want to call it, where when people don't like something on the right, they call it socialism or socialized or whatever.
Yeah.
But at the same time, the people who vote that way are statistically more likely to be claiming socialized benefits in this country. However, apparently they're too stupid to know what those are. So like what's happening quite frequently with in recent times where, everybody's, kill Obamacare, kill the ACA. It's the ACA, right?
Mm-hmm.
But of course, every state has white labeled their own name for it.
Yep.
Right.
Yep.
So take away, kill Obamacare. But, if I'm in Tennessee or Kentucky or whatever, it's called something else. And there's no connection. They don't understand.
Exactly.
So it's this ridiculous disconnect, but people want their Social Security. They want their subsidized health care. They want, we can go on and on. They want roads. They want fire departments. They want all these things.
Yep.
That's all fucking socialized.
They
That's
want
what
that
it is.
Pothole to be fixed.
Right.
Yep.
That would fall under the roads category.
Touche.
Right. So yeah, it's in order for all of those countries have socialized government safety nets that address these issues. And I don't think either one of us is saying any of these countries have perfected any of these things.
No.
But the problem is that, it's a hard problem to solve regardless, but we have created a Rube Goldberg machine, which is just designed for people to dip in and take money out without adding value. And so until we address that, it's never going to get better.
Nope.
I will refrain from saying it's going to get worse. Probably will, but it ain't going to get better. So.
God, it's hard to imagine it getting worse, but it could. Yeah.
Oh, it can. And prediction, we have somebody in the White House. We have a group of people in charge of every branch of our government who are trying to kill any semblance of socialized healthcare. And by definition, it gets worse.
Right.
Right?
Yeah.
Because all of these people, a large proportion of which voted for this,
mm-hmm.
will lose their health care.
Right.
Or their healthcare costs will go up.
Right.
Or what, it's these people don't seem to understand how insurance works, which is if you reduce the pool of people paying in, the costs go up for everybody. And so, it's an attempt to destroy the system one piece at a time.
Right.
Right.
Yep.
So anyhow.
Well, on that cheery note, that's all I got.
So I guess as usual, there's really not a solution there.
Wrong. There is a solution, but we just expect it to go ignored.
On brand.
Well, that's all I got.
That's all I got.
Let's call it.
Laters.
Bye-bye. Thank you for persisting with us through this episode of Nevertheless Persisting. We drop new episodes on Wednesdays, long COVID willing, and you'll find us most places you can find podcasts. You can listen to our episodes ad-free on Patreon for just $5 a month. And you can also support us by sharing the podcast with a friend and leaving a 5-star review wherever you listen. Thank you so much for your support. It truly means the world. Until next week, keep on persisting.